Vaccination for adults. Vaccination aren't just for kids. Some of your childhood vaccination might have worn off. New vaccines may have been developed since you were younger. And if you travel, work in healthcare, or have certain illness, you need extra vaccine to protect yourself and people you love. Make sure you are up to date. You never too or are to get vaccine. In fact, sticking to an immunization schedule as you age give you the best short and long-term health. An ounce of prevention is really worth a pound of cure, say Evan Anderson. Many adults are at risk of vaccine preventable illness, and sometimes damage is done after an infection has set in. So, being able to prevent illness better than trying to treat it once it's set in. If you are unsure of your immunization status, talk to your doctor. Meantime, here's some of the one you want to make sure to get update. Flu vaccination. Doctor agree your best protection against the flu vaccination. Who should get it? Everyone can get it. Young, old, in between should get flu shot, but especially pregnant women, people with long-term health issue, and people over 65 years of old who can't get it. If you have a severe life-threatening allergic reaction to flu vaccine, are allergic to eggs, or have had Guillain-Barre syndrome, which causes tingling, weakness, and loss of movement in your muscle, talk to your doctor about whether you should get it or not. When to get such vaccine? It is important to get a shot of every year. Each will last just one flu season because of the virus evolves. So what work this may year not work well next year. Another vaccine is TDAP. This stands for tetanus, diphtheria, and pertussis vaccine. All these can cause serious illness or death. Tetanus diphtheria cases have gone down 99% since the vaccine was introduced. Whooping cough cases have fallen by 80%. Who should get such vaccine? Everyone. It is also safeguard for those most vulnerable to the disease, like people with compromised immune system. If you are pregnant, it is especially critical to get the TDP vaccine. It gives you baby short-term protection against the whooping cough. Who shouldn't get it? If you had a seizures or allergic reaction to TDAP, you may need to avoid it. When to get it? If you are pregnant, you should get it such vaccine between your 27 and 36th week. Your baby will get his own vaccine called TDAP once he was born. Everyone should have a booster for tetanus and diphtheria toxoid. Vaccination for hepatitis A and B. These are the two viruses that infect your liver because between 2000 and 3000 people get hepatitis A each year. About the same number get hepatitis B. The vaccine will protect adults for at least 25 years. Who can get it? Anyone can get hepatitis A or B, but you are most at risk if you are travel outside the country, are a men who have sex with other men, use illegal drugs, having a clotting factor disorder like hemophilia, come into regular close contact with someone with hepatitis A, have a chronic liver diseases. Who shouldn't get it? If you have allergies to anything in hepatitis A or B vaccine, talk to your doctor. If you are sick when you are scheduled to get either shot, move to the appointment when you are well. If you are pregnant, ask your doctor before getting the hepatitis A shot. How you get it? The hepatitis A vaccine come in two doses, 6 months apart. The hepatitis B vaccine takes three shots. There are also combination vaccines that protect against hepatitis A and B, and it come in three doses. HPV vaccination. This stands for human papilloma virus vaccination. The infection it is cause and lead to cervical, vulvar, and vaginal cancer in women and penile cancer in men. It can also cause anal cancer, throat cancer, and genital warts. Pneumococcal vaccination. Infection with this bacteria can lead to pneumonia, meningitis, blood infections, and death. There are two vaccinations for it: PCV13 called pneumococcal conjugate vaccine and PPSV23 pneumococcal polysaccharide vaccine. Mumps, measles, and rubella vaccinations. The MMR vaccination. It's provide protection against all these three category of diseases. The number of measles cases in the United States is on the rise. This is because more and more people are immunized. That's all for today's topic.